You've probably heard that ultra processed foods are driving obesity, heart disease, cancer, and maybe also your bad mood and your inability to fold a fitted sheet. But what even are ultra processed foods and how exactly are they interfering with my laundry? That's the topic of this week's Healthcare Triage. The concept of ultra-processed foods come from something called the NOVA classification system, introduced about 15 years ago. It groups foods based on how processed they are, from minimally processed to ultra-processed. Ultra-processed foods include what you might expect, chips, soda, cookies, but also things that might surprise you, like sliced bread, flavored yogurt, breakfast cereals, protein bars, and even infant formula. So we're already dealing with a category that's kind of all over the place. And that makes things tricky because lumping all of those foods together and saying this category is bad isn't very precise science. Even nutrition researchers have pointed out that the evidence against ultra-processed foods isn't as solid or straightforward as it's often presented. There are limitations, conflicting findings, and ongoing debate about how meaningful the category even is. And if that sounds familiar, it should, especially if you've been hanging out with us for a while. Because nutrition science has a history here, to put it kindly. We've had moments where we've confidently declared fat the enemy, and then cholesterol and even specific items like coffee have been declared both an enemy and a cure-all, and now some researchers are warning that we might be repeating that pattern, jumping too quickly to big, sweeping conclusions. Before you come for us, we're not implying that ultra-processed foods are secretly health foods or something. They are real concerns. Many of these foods are designed to be convenient, highly palatable, and easy to overconsume, and diets high in them are often linked to poorer overall nutrition. But when we say linked, we mean linked, not definitively proven to be the root cause of everything. Yes, there is research linking high consumption of ultra-processed foods to worse health outcomes. Studies have found associations with things like higher body weight and increased risk of disease. However, those studies typically just compare people who eat more ultra-processed food with people who eat less. And that doesn't automatically mean the food itself is the cause. There are other factors like income, lifestyle, and access to healthcare that can also explain those differences. And then there's an important point that often gets lost in the discourse. Not all ultra-processed foods are the same. Some researchers argue that there are plenty of relatively healthy options within that category, like packaged whole wheat bread, and that improving those might be more useful than demonizing the entire group. So when headlines shout that ultra-processed food is causing every health problem known to man, that's a leap. Unfortunately, once that idea hit the public, it spread fast and it really stuck. We talk about it now like it's absolute, even though science rarely works like that, especially nutrition science. The more grounded takeaway is this. Yes, diets heavy in ultra-processed foods are often associated with worse health. That's worth paying attention to. But the science isn't strong enough to say those foods are the single driving force behind modern health problems. And the category itself is so broad that treating it like one uniform thing doesn't hold up. So instead of thinking in terms of processed equals bad, unprocessed equals good, maybe we should aim for eating a variety of foods, paying attention to overall diet quality, and not making life decisions based on whatever food trend is currently yelling the loudest. Because if nutrition science has taught us anything, it's that today's dietary villain has a habit of being quickly replaced with the next scapegoat. We'd really appreciate it if you'd like the video, subscribe to the channel down below, maybe go on over to patreon.com/healthcaretriage where you can help support the show, make it bigger and better. We'd especially like to thank our research associates, Edward Lilyaholm and Christopher Learn, and of course, our Surgeon Admiral, Sam.